in my position for just about 4.5 years now.
Wow, it's really gone by fast.
I know. It feels like it was just yesterday that I started.
Oh my goodness.
Time goes fast.
All the wisdom I have in the room and expertise, that's good. Let's just start with the basics about women's health. How many people work at Women's Health and what services do you guys provide?
Yeah, right at about now, we have about 25 people who work inside the clinic, and that ranges anywhere from nurse practitioners to nurses to social workers, maternal health nurses. We have our wonderful staff up in the front desk area, our billing people, and then Together for Youth as well. And the services that we have are pretty much focused, as you mentioned, on women's health. And we have family planning services, we have maternal health services, and then Together for Youth. Within our family planning services, we can have pregnancy testing. If people are interested in a birth control method or a well woman visit, they can do that. For our maternal health patients, there's, as I mentioned, a maternal health nurse. So there's some education that patients can get to make sure that they're having a healthy pregnancy, that they know what to expect with delivery and that kind of thing. And our wonderful social workers help get them set up with making sure that they're getting the resources that they need and that are available for them. So,
Great.
yeah.
Now, where are you guys located on the Allen campus?
We're located on Vold Drive, which is right in between Allen Hospital and Allen College. We're kind of sandwiched right in there. And yeah, a little brick building right on the corner of Vold and Heath. So,
I always like to call it the little hidden secret.
yes,
Yeah.
yes.
Yep. Right in front of the college.
A wealth of knowledge, that's
Yeah.
great. Okay, let's dive right into it. So exactly, give us a brief overview of what exactly is TFY.
Well, we have a lot of acronyms in this business, and so you started off with the most popular one. TFY stands for Together for Youth,
Okay.
and our mission, we are a coalition of community partners. We're working together to improve adolescent sexual health outcomes and also to strengthen young families, not only in Black Hawk County, which is where we do provide the majority of our services, but Elisa, we're also providing quite a bit of programming in Bremer and Buchanan. And then Erin has also started providing health education programming in union schools as well. And so it's not just Black Hawk County. But I definitely wanted to mention the agencies in this community that make up the Together for Youth Coalition. We have been a partnership for over 25 years, and we
Awesome.
certainly couldn't be providing these services and seeing the adolescent sexual health outcomes that we've seen without this partnership. So I wanted to mention TFY is made up of Allen Hospital, Allen Women's Health, Covenant Medical Center, and so what a great thing to be able to say that both of the hospitals in this community are collaborating on such an important issue. Also, Tri-County Child and Family Development Council is part of our coalition, Family and Children's Council, Black Hawk Granny Mental Health, the Black Hawk County Health Department, Success Link, and then Waterloo Community Schools. And also, we are under sort of a state umbrella as well. Our state organization, Eyes Open Iowa, we wanted to make sure to mention them as well. We partner with them quite a bit, and so there are programs like Together for Youth across the state addressing teen births and STDs, and we all fall under the umbrella with Eyes Open Iowa, and so they're a really important piece to this puzzle as well. We do provide, Erin touched on this a little bit, so we sort of have two components to our programming. We have adolescent sexual health programming, so we're doing prevention programming within the schools and youth serving agencies. So we're doing community health education in classrooms and group settings. We also have individual health educators that are meeting individually with students at our local school-based health sites called Success Street. We have programs such as Baby Think It Over where students can actually take home a simulated doll and care for a doll overnight, and there's actually a care report that prints after they have taken care of this doll to see how many times they fed the doll, how many diaper changes they made, things like that.
That has to be something new. I remember when my son had to do that and there was no care report. Probably was a good thing though.
Well, and you know, it's a great discussion because once you see these care reports, it's a discussion with the student. Okay, gosh, you only maybe cared for this doll 60% of the time. Can you do that with a real infant? And so it generates a lot of great discussion.
Well, and it also plays into the role of, you know, at this point in your life, it may not, you may not be able to provide 100%, but does that mean that when you're older, that you won't be able to? And so I think that it's almost kind of an empowering piece as well, thinking like, okay, so yeah, now isn't the time to be a parent, but maybe later on would be a better time.
Awesome.
It's a really fun program.
That's another one of you guys' mottos is teachable moments that you can have with your kids.
Right. We also have a teen parent panel where teens who are pregnant or who are parenting can talk about the realities of being a teen parent. They go into local classrooms, and then we also have a Wise Guys program specifically for our young men. So that's sort of on the prevention side of what we do. Then we also have a very important program called Young Parents Together, or YPT, another acronym, which is our weekly support and education group for pregnant and parenting teens age 19 younger and their children. And this is a really comprehensive program with several of the agencies that I listed earlier coming together every week at the YWCA to provide education and support for these pregnant and parenting teens. And actually, I think we have a program coming up this summer where we're talking all about YPT here at KBBG. So that's on the other side of our continuum of programming.
Wow, you guys are very busy. When you mentioned Eyes Open Iowa, I remember, I think last year I had the opportunity to visit their website. Phenomenal. I would just recommend everyone go to this website. It was amazing. And I think I even joined and received a newsletter or something, but it was awesome.
Well, one of the nice things about their website is that it has county breakdowns
Yes,
with the
yes,
data, and
yes.
so you can see how your county is doing with the adolescent sexual health statistics.
And I want to give you guys kudos, claps. You guys are doing an awesome job. The numbers continue to decrease throughout the years, and just awesome. And just the collaboration that's at the table is amazing.
And the fact that we've collaborated for as many years as we have.
Over 25 years, that's awesome. That is great. Now, we talk about adolescent sexual health. What exactly is that? How would you define that? Would you define it by an age?
I think to some point, yeah, an age or maybe even maturity level as well. And we know that especially during adolescence time period, sexual health is really important because the decision making that happens can affect a lot of different pieces of the life that the person will have. Go ahead.
Well, and I think not only is it discussing abstinence and the importance of abstinence, but also educating students about, you know, if you are sexually active or if down the road you're thinking about that, talking with them about, you know, different types of birth control. Also talking with them about, you know, what are sexually transmitted diseases and the signs and symptoms, or you may not have any signs and symptoms. And then in terms of educating, I think it's also even more important to educate about community resources. We have what's called What's Rare for Teen card, and it's a little billfold sized card that lists several area resources, including Allen Women's Health, including resources for substance abuse or mental health counseling, but not only educating our young people about their health, which is very important, but also educating them about where can they go if they do have questions or they do need to set up an appointment somewhere. Where can they go and who can they trust in their community to get resources and to be knowledgeable about those resources as well.
And especially to get the accurate information, because I know there's a lot of myths, and a lot of times kids will tell kids, you know, the wrong information thinking that they might help them.
Well, and even on the internet, there are lots of places on the internet that have inaccurate information, and those might be places that are visited by anybody of any age. But it is important to know which ones are going to be good sources to go to. And one of the really nice things about the What's More for Teens cards that I really like is that it also lists some different internet websites that have that
Oh,
medically accurate
great.
information.
Mhm.
And they're designed for a teen audience. So
Mhm.
they're very teen friendly in how they look, the language that's used. Some of them even have different contests that the teens can join, and so they're more interactive. And
Wow, that's great. Now, Brooke and Aaron, why do you do what you do?
well, again, with the decision making, that affects a lot of our lives, and it affects people on the individual level, but also on the community level. You know, we're bombarded with different media messages
Mhm.
all the time that can really have an impact on how we view our lives and the decisions that we make, and just our perceptions on sexual health.
Mhm.
And so
Sure.
making sure that we're addressing that, and that, as Brooke was mentioning, that people are connected with safe places to go for good, reliable sources. And I think that that's kind of, at least my main motivation of doing this is, you know, really empowering the participants that we work with so that they can kind of take charge of their own reproductive life and make sure that they're doing what they need to do to make good decisions for themselves.
Mhm.
Oh, that's awesome.
Well, and we really started this coalition over 25 years ago because Black Hawk County had one of the highest rates of teen births in the state of Iowa. And I really believe that because of this work of our coalition and the partnerships that we've formed, and the programming that we're doing in the local classrooms, you know, we have seen a decline in our teen birth percentages that's twice the rate of the state of Iowa, and we're at a historic all-time low. And so, you know, I hope that we've, you know, had a piece of that success, and I think that's why our partnerships have been so important.
Do we have some numbers of, you know, the declining rate or a percentage rate of where now or here now?
Yeah, so for example, in 1995, our teen birth percentage was 17.5. And in 2012, which is the most recent data that we have, our percentage was down to 6.2, which is an incredible decrease in that
Awesome.
number of years. And we're really excited about this. The thing that we're still working on is with our youth of color in the community. African Americans make up 8% of the population here in Black Hawk County. However, they account for nearly 17.9% of the teen births. And so we're wanting to make sure that we're addressing that disparity and making sure that education is happening as well as resources.
And we are addressing that. An important piece to the programming that we're providing out in the community is for our local youth of color. And so we do have a program called Soleil, and this is for our African American sisters right here in Black Hawk County. And our coworker Heather is facilitating that program.
And she's done a fabulous job
She
over the
has done a
years.
fabulous job with that program. She has. And then also Erin is facilitating our Cuidate group for our local Hispanic youth, both
Explain.
young girls and guys.
Yeah, well, the Cuidate program is a program for Latino teens. So one of the ways that it differs from the CLA program is that it's for both males and females,
Awesome.
which is kind of nice, just because there are gender role-specific pieces that are talked about in the program. And it's a culturally based program, so there's a lot of things that are talked about as far as, you know, cultural values and how they relate to our sexual health decision making. And then we also talk about refusal skills. We make sure that the participants have the tools that they need to make sure that when they are in the process of making those decisions, that they feel confident enough that they can do that. So that includes a lot of role play to get some practice with using those tools. And yeah, we've been doing that program, geez, I think it's maybe been since 2011. And we've
Sounds right.
graduated a number of individuals, and we're really excited. And we actually have a group coming up in June that I think we're going to talk about a little bit later.
And we have a Soleil group also coming up this summer as well.
Okay, my guests today is Brooke Olson and Aaron Kubik, adolescent sexual health educators at Allen Women's Health in Waterloo. Brooke and Aaron are talking with us today regarding Together for Youth and Teen Pregnancy Prevention Month. When we return, we'll learn more about these important services right here in our community. I am Elisa Walker, and this is the AllenCare Show.
Getting out of the military, I was missing this camaraderie.
Oh, good.
It's frustrating.
Should we do the STD numbers?
That's what I'm going to ask you if you want to go back to.
That would be good. So.
Yeah, this just goes.
It does. I'm just learning so much. Oh my gosh, that is so great.
Well, you know, Elisa, the teen birth percentages last year,
More or less encouraged me, go to
we
the
had a
theater,
historic
veterans,
decline, and then the new numbers come out in the summer, and then this past summer, the numbers came out again, and it was another decline. We're like, what? So we're just gonna enjoy it. I don't know what will
That's
come
right.
this summer, but it's just like, you've gotta be kidding me. Yeah.
It's okay, we're
Well, and even with the STDs, though they're still higher than what you want them to be, there's still a decline, yeah.
veterans was the best
Take it.
Yes, we
method
will.
for learning to
Wow.
burn that success.
Yeah.
Hear veterans' real stories of strength and recovery at
Heather
MakeTheConnection.net.
doing- Welcome back to the AllenCare Show. My guest today is Brooke Olson and Aaron Kubik, adolescent sexual health educators at Allen Women's Health in Waterloo. Brooke and Aaron are talking to us about the Together for Youth and Teen Pregnancy Prevention Month. Before we went to the break, we was talking a little bit about why you guys do what you do. And why don't we focus a little bit on the teen birth rates? It's just kind of been a roller coaster over the years, so.
Well, our teen birth rates, you know, our coalition started over 25 years ago because Black Hawk County had one of the highest teen birth percentages in the state. And we are so proud today to be part of the fact that we have experienced in Black Hawk County a historic decline. 1995 was the highest year for teen birth percentages at 17.5%. And in our most recent numbers in 2012, we're looking at a historic decline of 6.2%. So we're definitely proud of that. And I think another piece, you know, when we're talking about adolescent sexual health, is definitely the sexually transmitted disease rates among teens in our community as well. So we wanted to talk a little bit about that too.
Yeah, in 2009, our middle school and high school aged youth were diagnosed with 40% of all of the chlamydia and gonorrhea in Black Hawk County.
Now you said middle school, so I'm thinking age 12, 13, middle school.
It's possible, yeah. And then in 2012, as our most recent data, they made up 28.6% of the chlamydia and gonorrhea. And so there is a decline that we're seeing, still higher than what we want it to be,
It's
but
going down.
that number's going down, right? And then, again, unfortunately, we're seeing that a disparity among our youth of color. The African American population in Black Hawk County make up about 8%, and the youth make up about 48% of the chlamydia and gonorrhea diagnosed among teens. And then again with Hispanics, which plays into role with the Cuidate program, Latinos account for about 3.9% of the population in Black Hawk County, and then the Hispanic teens account for about 6% of the chlamydia and gonorrhea in our county. And so there's a health disparity with that as
Right.
well.
So when we think about teens, are we saying 13 to 19 or 13, 19?
Age 19 and younger, I would say. And again, you know, when we're talking about youth of color, we have the Soleil program, Sisters Informing, Healing, Living and Empowering is what Soleil stands for. Again, another acronym for our African American females. And then we have the Cuidate group for our Hispanic young men and women here in the community to try to address those STDs and teen birth rates.
Now, with all the information and all the community resources, what are you guys doing for May? And I know May is a teen pregnancy prevention month, so what's going on?
Oh,
What are some of the fun stuff?
We are so glad you asked. Yes, May is Teen Pregnancy Prevention Month, and also in May is Women's Health Week.
Yes.
For women of all ages. But you know what, Erin and I, as we were driving here, we were so excited about the events that we had, that we have going on this year in May. We've really done some great things. What we did this past Monday, we went to the Waterloo City Council meeting and had our mayor sign a proclamation proclaiming May as Teen Pregnancy Prevention Month.
Yay.
And we also, as I mentioned earlier, we're doing quite a bit of programming in Waverly. So we are going to be going to their city council meeting Monday evening and having them proclaim May, again, as APP month, Adolescent Pregnancy Prevention Month. So it's great, again, to have that community support and just kind of that recognition out in the community of what May stands for. Also, we were really excited. We wanted to announce today, everybody out there listening, Together for Youth has a Facebook page.
Woohoo!
Yes,
And
so.
you heard it first, right here on the show.
First here, Lisa. So, for all of you out there in the listening world, if you are on Facebook, search us at Together for Youth Waterloo and like us on Facebook. May 7th was the National Day to Prevent Teen Pregnancy, and we have had lots of different Facebook posts throughout the month of May just to provide recognition for that month, also for Women's Health Week. We also partnered up the national campaign to prevent teen pregnancy. They had what was called a thunderclap, which was new to me. It's sort of like a virtual flash mob.
Wow.
And so they had agencies across the United States that at the same time on May 7th posted out about the National Day to Prevent Teen Pregnancy. And so what they were hoping to do was then generate all this activity, and everyone on Facebook could see that May 7th was the National Day. And that's called a thunderclap, so we were part of that. Our fabulous intern, Shauna, she created gum packs that we handed out here in the community advertising various adolescent sexual health facts and data. So we handed these out to local legislators, school personnel, our community funders, partners, and advocates. One of the examples from a label on the gum pack was this: chew on this. Black Hawk County has an all-time historic low rate of teen births at 6.2%.
Oh, that's awesome.
Kind of
That's
witty.
great.
Yeah. Another big thing that we did, our health educators coordinated this with the schools. Every high school student at East, West, and Expo completed a pre-test during their Futures, which is their homeroom class.
Okay.
And the pre-test had questions regarding adolescent sexual health facts. Then the students watched a video on National Teen Pregnancy Day and completed a post-test. And then what the students were encouraged to do was present their post-test at Success Street, which is the local school-based health clinics in Waterloo, and they could enter their name in to win a prize. And we've just had a lot of great feedback from this partnership from both teachers and students. And another result of this is students who may not have gone down to their Success Street clinic before, they were able to go down there, realize where it's located, the services they provide, and just be more knowledgeable again about another resource right at their school. We've had letters to the editor in our newspapers, and then also I'm wondering, I'm sure several of our listeners out there, our coordinator, Joni Spencer, was interviewed on KWWL a couple weeks ago, giving us some pub on low teen birth rates and the savings that our counties experience when teens avoid early parenthood. So we're really excited about that too.
And I think, and when you mentioned Joni, I just want to give a shout out to Joni because she has worked numerous years, with this program and getting it from, just kind of planted the seed and just grew it. And I just want to thank her for even being a part of the program and being in the community, because this community is truly blessed to have her, because all of you guys have passion and compassion for what you're doing, and that's awesome. I want to give you guys kudos.
Yes.
Now, what are some of the upcoming events?
Well, we have a lot of different events that are coming, and I think one of the best ways to stay on top of what events are going to come up are our Facebook group, like Brooke said. So yes, go to Facebook and search for Together for Youth Waterloo and like us. We have different groups that are coming up. As I mentioned earlier, I have a Cuidate group that is coming up in June. We have a CLA group that's going to be coming up. I also do another program called Reducing the Risk, and that's going to take place on the Quakerdale campus this summer. And we did that last